PCV2 is kind of near and dear to my heart because this is what most of my research was when I was going through grad school. So today, hopefully we'll have an understanding of what kind of occurs in the sow farm based with PCV2 infection, and then talk a little bit about vaccine and how it can be used in the sow farm to prevent disease or transmission. At the general background, PCV2, there is multiple different genotypes. There's PCV2A, 2B, which are the most prominent, and then there's type C, D, and E, which are based on molecular testing and have not amounted to anything at this point and stayed where they're from. But A and B are the most prominent, and in 2005 there was a global shift from that made PCV2B the most prominent. And this is what we saw here in the US. That's when it was introduced, and that's when the disease kind of struck and we had all these cases of PCVAD. Now in the US, most herds are positive, meaning there's not a negative herd. All pigs that generally live in the US are exposed to this virus. Disease usually occurred, what we saw here in the US, about 2005 and beyond. But if you go back a little bit, historical antibodies will tell you that the virus was here long before that. At least 1985 is what we can detect. And even goes back farther in Europe, where 1967 is when the virus was found. But disease yet didn't occur until just this past decade, really. PCV2 is also a very interesting virus. It's a little bit different than PRRS or SIV than what we're used to talking about. PCV2 has a long viremia, means they're infected for a long time. And what that does is it takes a long time for them to recover. And the other problem with that is the virus actually likes immune cells. So it kind of hangs out in immune cells and renders them incompatible or incapable of doing their job. So thus you get a little bit longer immune suppression aspect of the disease as well. So dam infection, that's probably the most important part of the whole deal when it comes to a sow farm. This can occur at any point in time to the dam, and usually it's because we're introducing new animals to the farm. Also, this is a very robust virus. It's very difficult to kill. So thus the sow farm itself, or new locations where we're bringing these animals, are a potential infection source. And just because a pig gets infected one time doesn't mean they can't get reinfected. They can get reinfected with a different virus, or after their antibodies wane, they can get reinfected again because they have no immunity. So there's a lot of different things going on in a sow farm with all these animals coming in and the environment being somewhat dirty. We're always adding new things to it. Thus, we can have infections at any point in time. So the gilts are probably the most important part of why it survives on a sow farm, just because it's a new, naive population that the resident virus can infect and propagate. So after dam infection, what happens is the fetuses get infected, right? Well, the most important part of dam infection is dam viremia. Once the virus is in the blood, what happens is it's able to cross the placenta, and in a sow or dam that's infected, it'll get to those fetuses. Sow viremia is the most important part. That's the most common way it gets to the piglet. There are some lesser ways, one being colostrum or milk. Sometimes PCV2 can be shed in there. It is known to be infectious. However, the significance of that route of transmission to a piglet is pretty minimal, or at least and also partly unknown. So the most important part to remember of getting to a fetus is actually the dam is actually infected and she's delivering the virus to her unborn pigs. Now the outcomes of fetal infection are a little bit different depending on the time of infection during gestation. If the dam is infected early in gestation, PCV2 has a much more severe outcome. At that point, PCV2 has a tropism for the heart, and it causes heart failure in those baby piglets, and they die. If infection in gestation occurs later, after 70 days, 70 days is when the unborn fetus can actually start making antibodies and help defend itself. That virus actually goes to lymphoid tissue, similar to what is in growing pigs. So there's kind of two different scenarios going on, and all depends on when the dam was infected, what you actually see on the sow farm. So this is a very important part of this presentation, is actually to make a distinction of what can occur at the sow farm. There's three possibilities. And the null hypothesis would be nothing, which would be number 3. Okay, that usually doesn't happen. It's usually 1 or 2. So we can either end up with PCV2 associated reproductive failure, which is the full manifestation of disease, or we can have something called PCV2 In-Utero Infection, which is basically the subclinical aspect of infection at the sow farm. And these two, both points 1 and 2, differ by clinical signs, the dam age sometimes, and the timing of fetal infection and diagnosis. So the first one, PCV2-associated reproductive failure. This is very common in naive animals. Generally, they're seen in all gilt farms, or gilt entries, or repopulated farms. Okay, so it's a naive population that's never seen this virus before, and they're the most susceptible to it. Clinical signs of the dam are usually minimal. Usually they look healthy and normal, but what you see is an increased number of mummified or stillborn piglets. That's the big key. Abortion can happen, but that's generally on a very minor basis. Again, the most important part that you'll see clinically in a sow farm would be increased numbers of stillborns and mummified fetuses. Here's an example of that. This picture shows very small fetuses at your right, and it kind of stair steps into these big stillborn piglets. This is very, very similar to porcine parvovirus that we talk about. Clinically, this is indistinguishable from that. You actually have to do the testing to officially diagnose it. But what you see is the virus is spreading in utero, taking pigs and dying them at different stages, and that's why you're seeing this nice stair step. The diagnosis is fairly straightforward and simple, of just running a couple tests and IHCs, and we get a diagnosis of a PCV2-associated reproductive failure. The incidence or prevalence of that has changed over time, but prior to vaccination development and use in the US and around the world, it was speculated that somewhere between 10 to 20% of all reproductive failure cases on farms would be associated with PCV2. I went back and looked at the Iowa State data, pulled all these numbers from 2003 to 2010, and in that time frame, we had 501 cases of reproductive failure in pigs, and 58 of them actually happened to be associated with PCV2. So that gives us a 12%. So the literature was correct in this case. Their averages or estimates are around somewhere between 10 to 20% of all cases around the world are probably associated with PCV2. Now, the second one was PCV2 In-Utero Infection. And I need you to keep these kind of separate. In-utero infection is much, much more common than associated reproductive failure. All parities or all dams can be affected, not just the gilts or the naive animals coming into the farm. Clinical signs are pretty much not seen. All right, maybe every once in a while you would get a few weak-born piglets, and the diagnosis is much more difficult. You actually have to take serum or samples prior to these piglets actually taking in colostrum. So it's quite different. And the prevalence is also different. There was a big study that we did at Iowa State a couple of years ago, and this was prior to vaccine use as well, where we looked at 5 different sow farms, 2,500 or bigger, across the Midwest. And what we did is we took 25 sows from each farm and bled 4 piglets from each litter, just as they're born. And what we found was quite astonishing. We found that, on average, 44% of the piglets being born on a farm that wasn't vaccinating were already infected in utero with that virus. Now, it did vary between herds a little bit. The lowest one was 17%, and the highest one was 71%. And in some instances, there was both PCV2A and B infection at the same time in some of these fetuses. This information was actually repeated in Korea recently, and they found a 33% infection rate. So again, differing from PCV2-associated reproductive failure, in utero infection is clinically silent. You don't see pigs being born that are dead, but they are infected. And so potentially, there's been other studies that have shown these infected pigs in utero actually succumb or develop secondary disease more frequently when they get to be growing pigs. So they may succumb to infections of respiratory disease pathogens and so forth. So here's my attempt to kind of show you the difference of these two side by side. PCV2 reproductive failure on the right, and then in-utero infection on the left. Again, the reproductive failure is going to have the clinical signs. You're going to have those stillborns and weak-born pigs, and the diagnosis is fairly straightforward. But the more interesting fact and the more prevalent is the in-utero infection, which can be any sow parity, is way more common if vaccine's not used, and the diagnosis is quite a bit difficult because you have to be there just as the pigs are being born to collect your sample. So the second part of the presentation is going, how can we prevent this? We all know that PCV2 vaccine has probably been one of the most economically important discoveries of the last decade in the swine world. It's huge. The vaccine is made out of PCV2A, but it cross-protects to PCV2B. We've seen the great effects of this vaccine and know that subclinical infections are quite common, and this vaccine has actually reduced that to production parameters of before we even saw PCV2. But when you take this vaccine and give it to pregnant dams, it's actually very safe. We've done it both at different times of gestations, and what we found is that the vaccine is safe. It's not going to cause abnormal effects or cause the sow to abort just because you gave the vaccine. So that's a good point. Also, this vaccine does a very nice job of producing antibodies, both serum neutralizing and IgG. You see it in the serum or in the blood circulating, and you also see it in the colostrum, which is being transferred to the pig. This is very, very important because that helps prevent the in-utero infection to occur. Just an interesting fact here that when you vaccinate some of these sows, they actually have a higher amount of PCV2 antibodies than natural infection. So there's a greater amount of protection potential that's there. So there's multiple studies that have looked at sow vaccination, and I try to make it simple and break it down into primary vaccine effects and secondary vaccine effects. The primary vaccine effects are what we can see or what are helping the sow itself. And vaccine induces the antibodies and completely, in our studies at least, diminished any signs of the viral infection. So we did not get any of those weak-born pigs or mummified fetuses. It also reduced sow viremia or infection in the blood, in some instances completely wiping it out. And more recently, just last year at ASV, or 2 years ago, sorry, we did a little study in a sow farm, an all-gilt farm, where we vaccinated all these gilts incoming and tested 500 and some odd piglets after they were born. And this vaccine to the gilts coming in completely dissolved fetal infection. We could not find in-utero infection if we gave it to the gilts in an all-gilt farm. So it's some exciting news. The other part is the vaccine does reduce or diminish colostral shedding, so a potential route for having infection to the growing pig. Now the secondary effects are those things that are added bonuses to the vaccine. And these are 6 things I have listed here, and most of these came out of European countries, but I think there's almost 450 sow farms built in to these 6 things. And all of these were statistically significant when measured on these sow farms. So it's pretty high denominator here. First thing it does is it decreases the wean to service interval. So you have decreased non-productive days in the sow farm. It's decreased sow mortality, because hopefully they're able to defend themselves from other infections. It's decreased pre-wean mortality, so more pigs be going out the door. Increase, similar to increase of wean pigs per sow per year. And the most recent one that I found rather interesting is if you vaccinate dams, you actually have a higher weaning weight on your piglets that are weaned. Also an increased farrowing rate. Some other noted secondary effects that have been touted is that very similar to the growing pig, where subclinical vaccination or subclinical infection wasn't really realized until vaccine was available, we've seen the same thing in a sow farm, where all these production parameters go up just secondary to some smoldering, possibly PCV2 infection going on. Also, there's been some indications that vaccinating both the sows and the growing piglets has an added benefit of decreasing both nursery mortality and finishing mortality. And this has kind of been anecdotal until recently. A paper just came out that shows a vaccinated dam actually transmits some immune cells that are primed from the vaccine that are given to the piglet, and they actually have a better immune response when it's vaccinated as a growing pig. So there's some new information coming out that says dam vaccination is actually quite a bit is beneficial for the growing piglet as well. Now, timing is very important when it comes to dam vaccination. I highly recommend that all gilts coming into a farm, since it's a naive population, be vaccinated sometime, whether in isolation or just prior to coming to the sow farm, because those animals then would be able to susceptible to the virus that's on the farm, because the farm has an active infection because we know it's there. Sow vaccination is more interesting and more controversial as we start to know more about it. What you want to do with sow vaccination is you want to protect the gestation period. Most vaccines nowadays we give pre-feral so that we have higher antibodies in the colostrum to protect the piglets during their growing phase. But if PCV2 is kind of different. You want to protect the gestation period so they don't get infected in utero. So with that being said, you need to actually vaccinate pre-breeding so that the dams are covered so they don't transmit the virus to the pigs in utero. There's also some playing around with whole herd vaccinations, and there's certain situations that this would be beneficial, but definitely we need to consult with your veterinarian, and then we need to, as Dr. Waddell said, kind of monitor this and see where we're going, because potentially we could screw up some things down the road with the piglet vaccination if our timing's off. So it is very important that we actually, when we decide to make a decision if we are going to vaccinate sows, is to get some accurate information, diagnostics up front, and then monitor these diagnostics as we go through to make sure we're getting what we think we're supposed to be getting. So real quickly, my take-home points would be that there's two different types of PCV2 infection in the sow farm. There's reproductive failure, and there's subclinical infection. The subclinical infection is much more common. Reproductive failure is generally seen in naive dams or gilts, and that's when you see the mummified and stillborn fetuses. The in utero infection, on the other hand, can be seen in any parity and potentially predisposes these piglets to co-infection in the growing phase. When it comes to vaccination, dam vaccination is safe, and it's definitely reduced infection in those animals and reduced in utero infection. And vaccination improves herd parameters of weaning weights, etc., so you have better performance. And lastly, the strategy you choose for vaccination is very important, and you need to consult with your veterinarian to make sure that you're getting the most bang for your buck